Things like patients. Patients are part of every day for what we do as physicians. Nursing is all part of that as well. And I include, staff in that, so clinical staff, administrators, to make sure that things are getting communicated properly,
Right.
as we look towards, leading folks at the hospital.
It depends who you are on the hierarchy. You need a 360. You need a senior executive that supports you. You need to engage with the peers that it's going to affect. And if you're a multi-location, you need to engage also with the peers from there. And you need people from infrastructure like information technology or engineering that will be necessary to accomplish it. Terrible design and failure.
The important things are patient safety. And so when a team is dysfunctional, that tells me the team, the different providers don't know their role. I think a dysfunctional team probably leads to frustrations for patients. And I think when you have a very functional team in the operating room, then patient safety goes up. And I think efficiencies also go up. So I think better patient care, and then as you increase safety and increase efficiencies, then costs go down.
Has the idea been vetted enough to gain support from the higher-ups as well as the line workers? If that's true, have we identified that person who will do the best job at being accountable? And combining those two things, has the membership been selected very deliberately?
So everybody has a role, and I think that's really important. On the clinical side, I think I would reiterate too that everybody has a role, whether it's scheduling a patient, getting them prepped for their pre-op.
The team leader himself has to be, or herself, has to be accomplished enough to be respected within this realm. And that person needs to know how to delegate, because nobody shoves anything through all by themselves. I think that the executive champion, the team leader, and the person with the idea make the ideal group of people to identify the rest of the team membership.
Yeah, well, I think a good leader will lead by example. I think a good leader will paint a vision for people. I think a good leader leaves a legacy. And what I would compare that to is somebody who manages people. And so when you manage people, you're there, you're counting the number of staff you have that day, you are trying to manage numbers and making sure, equipment and different things are in order. But I think that managers certainly differ. There's a big difference between a manager and a leader. And I think a leader, again, tries to draw out, not necessarily tell people what to do like a manager would, but they try to draw out like what the vision is and get people to come together for a sense of purpose. So I think the healthcare world is challenged by having good leaders. As you engage the employees and they're happy, then what do you think happens? Well, patient satisfaction goes up, and then you've got a happier work environment and a safer work environment for the patients. So I think that having that good leadership really does trickle down to all the staff and everybody involved with that patient's care.
No one person diagnoses, evaluates with imaging and lab, and renders care to a patient. It takes all of us.